Hey guys, this is Dr. David, physical therapist at El Paso Manual Physical Therapy. I'm going to talk to you all about hernias today. Now let's just define what a hernia is first. So on your abdominal wall, it's when your intestine pops out through the abs. Now here's a drawing of it. There's the intestines and it's popping out through the abdominal wall. And you can get them all over the abdominal wall. Many times I'll meet people that have had a hernia or they've had a surgical repair of a hernia and they attribute it to lifting something heavy. Sometimes I'll meet people that have a hernia and they never lifted anything heavy, it just kind of happened. So here's what I think. This is why people get abdominal hernias. They have weak abdominal muscles. One of the jobs of those muscles is to hold the organs in. Diastasis recti is another related problem. It's not exactly a hernia, but it's a separation of the abdominal muscles. So here's what the abdominals should look like normally. You should have that white tendon in the middle between them and the 8-pack or 6-pack muscles. And then once a woman goes through pregnancy, this all gets stretched out, and then after the birth is over, this stays stretched out. That's most common in women after pregnancy, but it also happens in men that have, the big bellies, the barrigas. And the solution in fixing both of these problems is to strengthen the abdominals. Because here's the thing, everybody that does exercises, weightlifting, and they're trying to get bigger biceps and all that, they don't realize that their tendons also have to adapt. It's not something that people are usually trying to do necessarily. Nobody looks in the mirror and says, look at my tendons or look at my ligaments. But the fact is, if all the other tissues besides the muscle, like the tendons, ligaments, cartilage, if they don't adapt, you're not going to be able to lift as much weight as you can. So the best thing to do is work on those abdominals, make sure that your abdominal wall is nice and strong so nothing pops out through there. If you think you have diastasis recti, there's some extra things to do. You might want to talk to a specialist about it before just strictly working on your abdominal. And most of the hernias we see are around the belly button area and around the inguinal area. It's within this span. You can get them elsewhere, but they're usually around here. So here's an important tip when you decide to start working on your abdominals. Make sure you target those lower abdominals where you're likely to have the hernia. And the way that you know you're targeting your lower abdominals is that if you feel the burn in this area more than up here, and also not in your thighs, it's not good. If you feel you've been doing abdominal work and you're not getting the lower abs to fire, please talk to your physical therapist, talk to somebody about it, figure it out. You might be doing abdominal work and skipping using the lower abs, which could actually feed into the problem. And then when it comes to lifting something heavy, you got to make sure that you're turning on or engaging your abs appropriately throughout all those heavy lifts. Thank you so much for tuning in. This is Dr. David Midoff at El Paso Manual Physical Therapy. Have a wonderful day.